My guest has built her public health leadership at the crossroads of evidence, lived experience, and a fierce commitment to community. Guided by the West African principle of Sankofa, go back and bring it forward. She left a 12-year career in the classroom to pour knowledge and care back into the communities that raised her. In this episode, she shares what it means to do it scared, to advocate for students finding their voices, to navigate a high-risk pregnancy as a Black maternal health expert, and to insist that stories are as essential to health as data. Together, we explore how courage can be inherited and renewed through storytelling, through village building, and through showing up fully in the fight for equity. You're listening to the Courageous Public Health Podcast, episode 27. To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women doing the work of public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting Firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Dr. Rahmatu Kassimu, known widely as Dr. K, is a public health strategist, educator, and founder of Dr. K's Health Minute, a platform committed to dismantling the systems that silence, marginalize, or erase Black communities. With a dynamic background that spans sociology, health studies, education leadership, and community organizing, Dr. K merges evidence-based practices with lived experiences to build equity-centered systems and stories that heal. Over the last decade, she has empowered students, families, and professionals through culturally grounded wellness strategies, academic writing coaching, grief support, and reproductive justice work. Whether she's facilitating a workshop on maternal mental health, decoding health policy on Instagram, or mentoring future researchers, Dr. K leads with radical empathy and unapologetic purpose. Her mission: to make complex ideas accessible, advocate for those unheard, and expand what it means to live well, mind, body, and soul. Ready to be inspired? Let's listen to my conversation with Dr. K right now. Hello there, Rahmatu, or Dr. K, as you sometimes go by. It's great to have you. How are you doing?
I'm doing well. Thanks for having me.
Absolutely. I saw your, what are they called? Your health minutes on LinkedIn. And I was like, oh yeah, this is great. Like, I need to have this person on the podcast because I really, I think it's like such a great idea. And I really like your energy.
Thank you. I kind of, not gonna lie, I kind of fell off a little bit when I got pregnant, and
Sure.
first trimester kind of took me out. And then it was like, okay, I'm going to get back. And then like, right as I was like, okay, I'm going to get back to consistently, because I used to do one a week, and it was
Yeah.
based off of, monthly health observances. So like, for example, January, I did one about cervical cancer. I did
Yes.
September, obviously, sickle cell.
Yeah.
October, you got to have a breast cancer awareness.
Yes.
Yeah, no. The first trimester, second trimester, I hit what they call it, the second trimester glow. And then I got
Yep.
told that I had a high risk pregnancy, and I was like, oh, well.
Yep.
But that has been my goal, to get back to consistently doing the health minutes, because that has been the feedback that I've been getting of like, okay, she 2 now. So, and I'm like, but
Well,
postpartum is 2 years, 2 to 3.
oh
Maybe
my
I'll do a health
gosh.
minute on that, because y'all aren't
Because you don't know.
complete, right? Because we don't know. So we'll do a health minute on that.
That is totally worth a health minute. Yeah, I've mentioned this. I've mentioned this book. Oh, let me grab this book. I've mentioned it several times. It's this book called Matrescence on Pregnancy, Childbirth, and Motherhood by Lucy Jones. And it talks about how, matrescence is like adolescence, right? There's this whole period, and it's not just, when you're pregnant or when you're delivering. In fact, when we become mothers, we're mothers forever.
Yes. Yes.
You know?
And I think that's a scary thing, that even
Yeah.
people who were like, who, since they were kids, was like, I'm going to be a mom. But then I'm going to be a mom in theory and I'm going to be a mom in practice
Yes.
are two
Very,
different things. When you
very,
realize that you're in charge, you're
yes.
responsible
Yeah.
for another human being.
It's a lot.
Yes. Especially if you're like, okay, if you're really trying to be like intentional, and you're trying to be like,
Yeah.
I'm breaking generational curses. I'm,
Yes.
making sure that my child is an advocate for herself. And at the same time, you're like, oh my God, it's a lot. It's a lot.
It's a lot.
That's a lot. I can't just, it is the whole, you can't just stick them in front of the TV.
Nope.
You got to.
I mean, you can, but that will have consequences.
Right. There's consequences to that. But, and then, there's the whole, when we were younger, well, yeah, but that was a different world.
Yeah.
That was a different world.
Absolutely.
And it's one of those things. I tell people all the time, I was like, it hits you about like day 8 after they're born. Day 8, when you're like,
oh my,
I'm a mom. I'm a mom.
Yes.
I made a person.
Yeah. Yes.
And now I have to keep doing things so this person doesn't turn out to be a psychopath. I tell people all the time, I was like, day 8 is when, and I had postpartum anxiety. I didn't have postpartum depression. And I feel like the whole, where they're like, postpartum depression, you have difficulty connecting with your infant. I feel like postpartum anxiety is the opposite of that, where it's like, so now you're like, all the things.
Oh my gosh.
The things. I was in the shower and I was like, what if she turns out to be a serial killer? What if she's a bully? What if she can't fight? And I was like, no. You're her mom. She's going to know how to fight. But and when I told my mom, she was like, what?
What?
My child, I was like, I'm in charge of this potato with poor neck control. And she was like,
oh my gosh.
I was like, what? I was like, she is a potato with poor neck control.
Totally.
But
my mom always referred to me as an infant as a pot roast. That I was just this like little pot roast. It was the 70s. Pot roast was like
it's I love a good pot roast.
I was like, yeah, good pot roast is
you eat for days.
I mean, pot roast and potatoes, like I'm down for that meal.
Yes. With the baby carrots and the little celery, you eat for days.
Oh, you eat for days. Oh, so good. Days. This is
But
so funny because, I always ask my guests to introduce themselves, and we've totally gone straight in on the motherhood thing
yes.
before you even introduce yourself. So, yes.
Well, I am Dr.
Introduce
Rahmatu
yourself.
Kassimu, aka Dr. K. I am the founder CEO of Dr. K's Health Minute, which provides easily accessible, digestible health bites, as well as academic writing coaching and public speaking. All of that to say, I believe in amplifying voices and telling stories, and specifically amplifying voices and stories of people of color. Um, Things that you will not find in my professional bio. Pretzels are my favorite food, and people like to be like, pretzels not a real food. Yes, it is. Uh, pretzels are my favorite. Because anytime anybody else, you ask me, that's the first thing that comes to mind. They're like,
Yeah.
so pasta, no, pretzels. That's what
No.
I said.
Yeah.
I could win gold for the United States if there was an Olympic category for napping. Yeah. Additionally,
Yes.
I am, as I have said already, a queen mother to an Aries princess who, from the womb, has been about. She gonna do what she want to do and how she want to do it. She was head down, face down from week 16,
Mm.
and anytime they wanted pictures, she wasn't moving. She wasn't having none of it. They would be like, "Can you get her to turn on your side? Maybe she'll." No.
Like, you get her to turn on her side. I don't know. I can't do
Right,
that.
like, what do you want? When
Yeah, what do you
want
want
me
me
to
to
jiggle?
do?
I don't
Right.
know.
It's not
Yeah,
that
no.
simple.
Yeah, she very much so a woman of her own mind, okay?
I mean,
And I love that for her.
yes, I love that for her too.
I
It's
love
like,
that for her.
and
But
it
also,
means mom needs a lot of naps.
well, no, like she's very she doesn't throw like tantrums, or at least not, she's never had a meltdown
Okay.
per se yet.
Mhm.
She was about 1.5. One time she threw herself back and she hit her head on the couch.
Oh,
Never did it again. Never did it again. And like her tantrums are more so like, if I'm like, no, you can't do that. Okay. And like even as a baby, she never really cried. She just kind of like made sounds of distress
mm-hmm.
until
Mm-hmm.
she just, I know you hear me. Okay, I'm
Yeah,
coming. But yeah, no. Like if it's the only thing that really makes her the happy birthday song. She does not get jiggy with it. Anybody party we go to, soon as happy birthday starts, the tears come.
that
Like
is
full
so
on tears. And
interesting.
I haven't figured out if she's like just overstimulated or if it's the
Mhm.
song.
Right.
But immediately, happy birthday breaks out. She's looking for me and she's crying. I'm
How
like,
does she do with other music? I guess that's
she
not
likes
just
music.
music.
She likes
Yeah, that's just
music.
people singing
I think, yeah.
badly,
I think that's,
usually.
yeah, I don't, and plus, depending on how you sing happy birthday, it's a depressing song.
Yeah, it kind of is. It's not really,
Happy birthday.
yeah, it's not really joyful. That's true.
I was like, who made this melody? Because this is not,
Yeah.
it's not actually happy. It's
Somebody
not
needs to
giving joy. But yeah,
somebody needs to like do a glow up for.
she doesn't do the cry. Well, she, same child though, will run through the house popping balloons. So I'm like, it's not the noise. I think it's the song.
I think
Like
it's
it's
this.
literally the song. I don't know what about happy birthday. Just don't do it for her.
Yeah, yeah. Say it, don't sing it.
Right. That's why I was like, okay, at our third birthday, I just need y'all to say happy birthday, and just
Right.
then
Yeah.
we're gonna have cake and that's it.
Yeah.
Don't sing
Fantastic.
it. I don't know.
You
I
know
don't
your
know, but
kid.
these are things that you find out. Like I thought it. Well, she doesn't like cheering, but she seems to have gotten over the cheering, and now it's just strictly the happy birthday.
Interesting.
Because I found out we went to one of her godfathers. He had a dance recital, and the first number went off, she was rapt, just watching. And then the lights went off and everybody got to clapping. And I was like, yay, clap. And then I realized she was like bawling. And I was like, oh
Oh
no,
no.
oh no. But like
Oh
once
no.
when we got to about the third or fourth number, then she was fine. And I was like, okay, it must be the cheers. But now,
Yeah.
yeah, I don't, now I'm but you know, joys of motherhood. You figure out things on the fly. Because I
Yes.
thought it was the cheering. We went to another party before. She was fine when they were singing happy birthday. But then, you know, after happy birthday, we got to the woo. She started crying. So I was like, okay, it's the cheering. Last party we went to, happy birthday. I don't know if maybe she's anticipating the cheer. Because happy birthday started and she was immediately in tears. I was like, oh, all right, baby. All right. And I was like, maybe we just need to put headphones on you for this part of the party.
Yeah. I mean, she's making her needs and her wants clear. So good for her. Good for her. You know.
Yeah. Well, I was like, well, all right. So now whenever we go to parties, I'm like, is it happy birthday time? Okay, well let's step out.
That's great.
Let's step out. We'll come back when y'all are done singing.
Right. Oh my gosh.
We'll come back. It's fine.
Yes. Well, thank you for introducing yourself. And certainly being a mother of a 2-year-old is, you know, front and center. It's front and center. I totally understand. Well, I want to have a chance to go through the questions. Mm-hmm. So my first question is about courage, because this is the Courageous Public Health Podcast. And I always like to remind our listeners that bravery is about taking action without fear, and courage is taking action despite fear. And so I'd love to hear about some examples when you acted courageously in your personal life, your professional life. Yeah.
So professionally, I just resigned. This past school year was my last school year as an educator. But professionally, and I feel like that was also a courageous thing, because things that they don't people, I'm sure people have said, or you've talked to maybe educators, maybe you've seen like think pieces where educators are like, there's a guilt that comes with like, I want to leave education. Especially like when you really have a heart for it and you have a heart for kids and you have a heart for like seeing them learn. Like my life principle, or my life is guided by the principle of Sankofa, which is a drink symbol. And if you ever see it, it's literally a bird leaning back on itself. And the concept is go and bring it back. So basically the concept is when the child grows up and they leave the village and they go and get knowledge and they get skills, experience, etc., you're supposed to come back to the village and bring it back and like spread it out with the village. So that was actually the reason why I became a teacher. And it's also the reason that like funnels my public health, because my public health pursuits and my public health desire, because 15-year-old me, high school me, you couldn't have told me that by this time I wasn't going to be Dr. K, MD. Dr. K, MD. That was initially the plan. We were going to be, I initially wanted to be a pediatrician until my OBGYN was like, yeah, but you got to be able to see kids in pain. And I don't know why that never occurred to me. I was like, I like babies. I want to be a baby doctor. Like, yeah, but you got to be able to see kids in pain. And I don't know why it never occurred to me. Like,
that's so funny.
Yeah, sometimes the kids you see are going to be in pain. Yes.
Pain.
And I was like, oh no.
Oh no.
I don't want to do that. And so then I was like, I'll be an OBGYN, because I was like, women been having babies since the beginning of time. You know, I just got to stand back and make sure that sucker ain't coming out sideways, again, in my nativity. But, you know, at this time, I did not know all the things that could go wrong with a pregnancy. But I was a sociology pre-med major undergrad. And my senior year, I took a sociology and public health class. And I was like, what is this? I like this. And in my mind, my overachieverness, I was like, well, to make my med school application more competitive, I was like, I want to get an MPH, get a master's in education or master's in public health. First class, I was like, no, this is it. This is where I'm supposed to be.
Love it.
And I still wanted to be Dr. K though. So we got the PhD in public health. But I say all that to say, there have been previous years where I was like, okay, this is my last year. This is my last year in education. This is the last year. I felt, but then the Sankofa would be in the back of my mind of like, there's more kids you can help. There's more kids you can help. There's more kids you can help. And I finally had to get to the point where I was like, there's always going to be kids. And maybe you can help them in other ways, which is what I have like already started thinking about. But in transitioning out of the classroom this last year, at the beginning of the year, I was like, this is it. And the this is it wasn't immediately like, no, but what about? And I was like, no, this 12 feels complete. 12 feels complete. But at the same time, you know, a certain person got elected and then people started getting laid off. And I was like, okay.
Yeah.
All right. And then, you know, you see all of the online things that are like, don't give in to scarcity mindset. Don't, you know, you gotta take the leap and and I'm always telling my students this. I'm always telling it because they're not like, well, miss, I don't want to talk to her because what if she says blah, blah, blah. And I'm like, you got to advocate for yourself. I'm like, I was having the moment where I was like, I can't be standing in front of these babies telling them you got to advocate for yourself. You got to stand up for yourself. You got to speak up for yourself. You got to put yourself out there. And I'm over here like,
yeah. Yep.
Mama's got a baby though. Mama's got a baby and baby got to eat. So, I actually resigned literally like 2-3 weeks ago. I think about 2 weeks ago at this point. And so, yes, there was a measure of fear there because I was like, you got a baby. Yeah. And if it was just me, you know, I was I would still probably be like, but someone else is depending on me also.
Yep.
So, but also realizing that I can still impact education, just maybe not in the classroom.
Yeah.
But I'm at the point in my life where I'm wanting more value aligned opportunities, and particularly, so I had been applying public health principles in my teaching as well.
Love that.
Like,
love it.
I taught biology, I taught AP environmental science, but best believe it was public health all up and through there.
Yes.
I did wellness things for my school. I was the SEL chair for multiple campuses. So like I'm encompassing, but I have also figured out, and these are things that I've also told my kids, that when you are in a position, you're in a place that doesn't actually align with your values, God, the universe, your ancestors, whoever you want to chalk it up to, will move you. Whether you want to be moved or not. So, and it's the fear that keeps us in places that we've outgrown. So another example, one of the schools that I was at, one of my students walked out. Not because of me, but because like there was a lot of administrative issues, a lot of it was like systematic issues. And as students, you know, they don't see all the like background things that may be going on. But to them, they had like an issue. And I was like, it's a valid issue. They came and asked me and they're like, well, what should we do? And I was like, they were like, we want to walk out. I was like, and the only thing that I said was, if you're going to walk out, you have to make sure that it's done well. Because if you don't, then all they're going to be like, oh, these kids are just doing stuff for attention. I was like, you have to make sure that it's done well. That if you do walk out, you can't be out there acting a fool.
Yeah.
Because then it takes away from your valid message.
Yeah. Yes.
That was all I said to these kids. But somehow or another, it was said that I was out here rebel rousing the kids and that the walkout was my fault. And I was like, I'm trying to make sure that they not out here acting a fool in front of your school.
Yeah.
But okay. And so when the kids came and asked me if I thought that they should still walk out, there was part of me that was like, okay, I feel like I'm going to put a bullseye on my back. But at the same time, I can't be true to me and I can't be true to who y'all know me to be.
Yeah.
If I tell you no, if you feel that you still have a valid reason for walking out, follow your heart, advocate for yourself. And they did. And a lot of things got changed. A lot of things got changed. I was like, look at you. But also I was out there like proud mama bear. Like, yes. And I feel like that's my legacy of teaching. Like I have my first year kids still reach out to me about things that they're doing in their life. And like when I made my post saying that I was resigning, so many comments, so many like love. And I was just like, but that at the same time, that was like edifying for me.
Yeah.
In that it was like, okay, you did what you were supposed to do.
Yeah.
In the time that you were there.
Yeah.
Personally, courageous things will probably be my pregnancy. I have endometriosis. And after 30, fibroids also brought their raggedy behinds to the party as well. So I did not think that I could get pregnant. And I've had 3 surgeries for endometriosis and fibroids. I had the initial surgery, which was how I got diagnosed, and then I had 2 myomectomies to remove fibroids and to like basically check and make sure that the endometriosis hadn't regrown. And after that last surgery, I had my 6-month checkup, and my reproductive endocrinologist was like, "You should be able to conceive naturally now." And I was like, "Yeah, girl. Okay." Imagine my surprise. Imagine my surprise. I was like, "Oh, okay." And so then, I actually made like a video about it, a TikTok. It was like, "What's one proud thing that you've done?" Because so my areas of expertise are Black maternal health.
Yeah.
And mental health and health inequities. And being an expert in Black maternal health is also being very, very aware that we have a Black maternal health crisis in the United States, and that Black women are 3 to 4 times more likely to die of pregnancy-related, illnesses. Plus, like, again, I never thought I could get pregnant. So, of course, like, that first trimester, I was like, every time I went to the bathroom, I was like, okay.
Yeah.
Like, I literally didn't buy anything until I was like 16 weeks because it was deeply rooted. I was like, okay, something. And then I let go of the fear, or at least I thought I let go of the fear, only to get my anatomy scan and be told that I had complete previa and that my pregnancy was high risk. And I was like,
yep.
But, and I wasn't home when I found this out. I was out of town. And I found this out from the fetal maternal medicine doctor. They called me, not my doctor's office. They were like, "You got referred." And I was like, "From who? For what?" And they were like, "Oh, did your doctor not tell you?" And I was like, "Tell me what?"
Oh no.
So yeah, that was a whole thing. But I was like, okay. Pregnancy got, I don't know if you call it upgraded, but pregnancy got upgraded to high risk. My complete previa did like resolve itself by week 30, I think it was. And I remember I didn't want to do like a big baby shower.
Mm-hmm.
I wanted to do like a drive-by pandemic baby shower.
A drive-by baby shower.
And my friends were like, "No." And I was like, part of me was mad because I was like, "It's my baby shower. What do you mean, no?" And they're like, "You didn't think that you could have this baby. She needs to be celebrated.
Yes.
Properly." And I was like, all right. Yeah. But like looking back on the memories and looking back on the pictures, I was like, they was right and I was wrong. They was right and I was wrong. And even though like, delivery day was horrible, because I spiked preeclampsia. Again, so pregnancy high risk, but pregnancy was never high risk because of blood pressure. And that day, and as I said before, my daughter had been head down, facing my back since week 16. That day, though, my last visit, I should have known. She was in there flipping every which way, turning every which way they needed her to. And I was just like, okay. And then somehow or another, my blood pressure spiked to 235 over 156. So she got delivered that day.
Yeah.
She got delivered that day. But, all the things like that whole, I'm always sometimes hesitant to ascribe the word courageous to myself. But then at the same time, I'm like, no, girl, you've done a lot of things.
Yeah.
While you were scared. So they wouldn't tell me what they sent me to the hospital. And initially she was like, we're going to take your blood pressure again because it was a little high at intake. I was like, all right. So she put the cuff on and she was like, oh, no. I was like, oh, no, what? She was like, it's 200. I said, you at 200 live, take it again. And so she was like, no, listen, you can hear it as soon as I let the cuff go. And I was like,
oh.
So immediately in my mind, I was like, oh, they finna make me deliver today. So I leave and I'm crying. I call my mom. My mom gets there. They check me into the hospital. The cuff is doing the thing, but the screen is behind me. And I was like, what is it? And she was like, the nurse was like, it's high. And I was like, what does that mean?
Right.
And then like 30 minutes later, they came back. They were like, yeah, we're going to do your C-section today because your kidneys are starting to shut down. And I was like, oh, all right. So, got me prepped and suited and booted and everything. I didn't find out what my blood pressure was until the anesthesiologist had the epidural needle in my back. That's when I found out because he was like, we're going to have you sit up and straddle the table and then I'm going to do it. And then that way we can just lay you back. I was like, all right. He's like, I want you to know it's going to be fine. I'm going to be here. He's like, we like to reassure when the blood pressure is high. And the nurse, who's not the nurse who's seen me all day, I'm assuming she's just like an OR nurse. She was like, we like to reassure when the blood pressure is this high. And the woman was like, well, maybe she's just nervous. And he was like, 150 is nerves. Her blood pressure is 235 or 156. Yeah, and so I just started crying. Yeah. And the nurse was like, are you okay? And I was like, yeah. And she was like, but you're crying. I was like, what else?
Yeah.
What else am I supposed to say?
Yeah.
But yeah, like I'm always hesitant to ascribe the word courageous to myself. But then I'm like, no, girl, you've done some things and you were scared. And I was I always tell my students like, and I was like, I can't, like, there's that tension or whatever. I was like, I don't know why you won't call yourself courageous when you be telling these kids to go out here and do it scared. And they be seeing you do stuff scared. So like,
yeah. Own that courage.
Yeah. Exactly.
Well, then I'm even extra glad that you came on the podcast because this is a chance for you to just like totally bask in your own courage.
Yes. Yes.
Those are great examples. And there's so many things that I can relate to. And especially the part of like, and you just started crying. And it's like, it's okay. Like it's actually okay for you to get to have that reaction. You know what I mean? Like,
I feel like that's illogical.
It's pretty logical, actually. It's pretty logical, and it's okay. It's okay. So, oh my gosh. So I wanna also ask you about how you express and embody your power, especially as an African American woman doing the work of public health. And we talked a little bit about the use of the term African American. Maybe you can speak to that first. But definitely, yeah.
So yes, I am Black. I am Black, blackity black. But it's one of those things where like people don't understand the difference between race, ethnicity, nationality.
Yes.
Race. I am Black. I am Black. Phenotype. If you look at me, you're just like, that's a Black woman. I am My ethnicity, though, is African. My mom is Liberian. My dad was Ghanaian. My dad brought my mom here when she was pregnant with me. I was born in the United States. My mom literally delivered me 2 weeks after she got here from Liberia.
Wow.
So but I am American.
Yeah.
Hence, I am a Black African American woman. And I bring all of those identities with me into my public health work. They they inform how I view things. And I personally believe that lived experience is not a hindrance. Like some people like to say that, researchers or public health people should like remove themselves from the work that we do. But I feel like that's a handicap. Like, why your lived experience is one of your biggest strengths because it informs your lens. And I know that some people will be like, yeah, but that means that you have bias and that, right. But it's also your job to dissect that bias, to hold yourself accountable. So you can't be like, I am this lived experience. I am this Black woman. I know this and that happens. If you're not like, okay, but because this and this happened to me, I can't look at this person and automatically be like, same thing.
Yeah, right.
You, me, same.
Yeah.
Because one, Black women are not a monolith in any way, shape, form, or fashion. But does it help me to have some affinity, to have like a entry point? Yes. But again,
100%.
You may be completely different from me, and that's fine. I have found that, but that lived experience still informs my areas of expertise. Like Black maternal health is an area of expertise for me. It's always been an interest for me. And it's also one of those things where I'm like, I didn't realize. So again, expert in Black maternal health.
Yeah.
Did not know much about actual pregnancy.
Yes. I get that.
Doctor would be asking me questions. You're going to do this. You're going to do that. Doula asking questions. I'm just like, what? Because it's easy to be like, yes, Black women are 3 to 4 times more likely to die because of cardiomyopathy, because of preeclampsia, because of post-preeclampsia. All these things. But no one is teaching about pregnancy, which is one of the things that I thought was so great. This past year, they changed the curriculum for me. I actually got to teach my kids about pregnancy.
Really?
Like for sex ed, I got to teach them about pregnancy. Like that was a lesson. And I went in.
Oh, I bet you did.
I went in. I was like, don't you ever forget. They watched a birth. They watched a vaginal birth. They watched a C-section. They were
wow.
Miss. I was like, yes. Keep them eyes open. Keep them eyes. But again, I'm a public health. Black maternal health is my area of expertise. And there was so much about pregnancy that I did not know about until I got pregnant. And so that's the braveness and like the storytelling. I am a huge proponent of telling stories, particularly because like that's how we used to pass on knowledge. And we're losing that. We're losing that. Or we're passing on knowledge in pieces. Because it literally, you ask your grandma, I had a baby. I got pregnant. I had a baby. Okay, what happened in between?
Right. Right.
Did you have preeclampsia? Did you?
Yeah.
What happened in between? Like, maybe we could have been prepared. Maybe we could have, I would have known some things.
Yeah.
And so for example, I grew up in a homeless shelter until I was like 5. And one of the health shelters that we predominantly stayed in was a shelter for women who were pregnant. So I was not one of those children who did not understand what pregnancy was. I might not have understood the mechanics, but I knew the baby was in there and then somehow it got out.
Yep.
And my mom, this how I know I was a self-centered 5-year-old. My mom disappeared for like a day and a half. And, because I was with the people at the shelter, it didn't, occur to me.
Yeah.
And then they were like, yeah, let's go to the hospital. I was like, go to the hospital for what? And they were like, don't you want to see? Because I'm thinking about, I was like, I'm not due for any shots.
Right.
And they were like, no, don't you want to see your little brothers? I was like, what little brothers? They were like, your mom was pregnant. I was like, no, she wasn't. She just fat. This was back in the day when they did the C-section up the middle. She literally had to show me her C-section before I was like,
Huh.
They do come out of there. But but things like that, my mom did not tell me she was pregnant.
Wow,
My mom did
yeah.
not tell me she was pregnant. So I was no, my mama wasn't pregnant. But things like that, we're passing down stories. And it's not even just like Black maternal health, it's like reproductive justice overall is mental health. There's still
Yeah.
stigmas, like, and I love that we're talking about it more. We have like safe spaces. Like there are literally hundreds, and probably thousands of pages that are literally, dedicated to Black maternal or to Black mental health, Latino mental
Yeah.
health, um, different spans of the BIPOC or like specific mental diagnoses. But then there's still stigma. There's still people that be like,
Yeah.
oh, you can pray it away. And I love that for you. But, sometimes you need some medication in addition to Jesus. You need
Yeah.
some medication in addition to Jesus. But I think that being brave in a public health space is being an unapologetic advocate.
Yes.
And I have had it to where in some spaces, and it's more so been in education, I think, rather than public health, where I have not fit into some people's boxes of what a successful Black woman should be.
Mm.
And because of that, sometimes I have felt like I have been passed up for opportunities, or like there have been perceptions of me that are not actually true.
Mm.
And sometimes there's those moments where I'm like, well, maybe there's a moment where you have like okay, maybe I should shrink.
Yeah.
And then I'm like, and then again, I always have the moment of like, you tell your students
Yes.
not to, so you shouldn't. And I'd be like, okay. So
Yeah.
that is my way of being brave. I show up in spaces, or I attempt to show up in spaces. I'm not gonna lie, sometimes instead of the 100%, I might give 90. But I try and show up in spaces 100% me, because
Yeah.
I know that when I don't, people who look like me suffer.
Yes. Oh, that's so true. Yeah. Thank you for that. I mean, that is absolutely about courage and owning your power. So I wanted to also ask you about your vision for the future. And I'm thinking about, vision for public health, vision for the communities that you work in. Oh my gosh, vision for your kids, your students, and also your personal vision.
I think particularly with what we're currently going through and how the current state of things, and how, there's that whole 300,000 Black women unemployed, and grants for health research and community advancements are being cut and slashed left and right. We're going to have to return to community and communal health, because the avenues for outside help are shrinking.
Yeah.
But at the same time, I think it's just a return, because human beings are not meant to be individual. And I feel like especially in the United States, our like emphasis on individuality and like meritocracy, and all of these things are the root of a lot of societal problems or societal ills that we see, and particularly like in public health, because like the me-ness, it's always the me over we.
Mm-hmm.
And don't get me wrong, me over we for self-care, yes.
Mm-hmm.
Yeah. But me over we should not be for when we are trying to combat a pandemic. Me
Right.
over we is not for when you should be driving the speed limit. Me over we is not
Right.
for when you should be wearing your seatbelt. Me over we is not for when you should be disposing of certain things properly. Like,
Yeah.
we have strayed so far from the communal path. That's why,
Mm-hmm.
like, I'm always so. I tell my students all that. A lot of my students, you know, they're pandemic. They're not pandemic babies. Like, people like to say that the kids who were born during 2020, 2021 are the pandemic babies. But at the same time, my students, even though they were older, were impacted by that, in that, like, social awareness, social skills, very so much stunted.
Yeah.
And I would try and tell the kids, I was like, we are not, as a species, we are not supposed to be individualized like this. We're not.
Yeah.
Like, y'all got to think about, even like, if we're going back to the hunter-gatherers, there was a reason why the community thrived like it did. Everybody had their job, everybody had their purpose, everybody was here.
Yeah.
But we have gotten to this individualized point so much that, like, again, the me over we is threatening societal well-being.
Yeah.
And not only is it threatening societal well-being and health, it's multiple aspects. Like, you got it in economics. Like, our current capitalist system is cannibalizing itself, because we're always like, I gotta do. And don't get me wrong, again, mama has a baby to feed.
Yeah.
I understand it. But at the same time, like, we were not meant to go through this thing called life alone.
Yeah.
And now, I always kind of like backdoor that, because the kids will be like, well, you know, my friend was doing, like, when it's a negative influence, my friend was doing, look, when you get to them gates and you in front of St. Peter, it's just going to be you.
Yeah.
It's just going to be you. But here on earth, as far as who you go through, you need to choose well.
Yeah.
You need to choose well. Like, I actually have a training about, it's called the act of being loved and being loved well. And I would always tell my students, and I think this is a thing that applies to to public health as well. We have lost intimacy, we have lost community, and we've lost, like, non-sexual intimacy.
Mm-hmm. Yep.
Because I feel like if there was more non-sexual intimacy, you would have enough care and enough community, and you would understand that, like, we're on a precipice. But I think for public health, that is where that is what we have to return to. We have to return to, like, our roots in community health. We have to return to our roots in, like, having wraparound services, and, like, being able to access readily these wraparound services. Like, it should, and, like, having warm referrals to wraparound services. Like, not just like, oh, well, this happened to you and I got this contact over here that can help you.
Yeah.
Here's their number, go there. I don't know them. I barely know you.
Right.
So I would love to see us return. And I know that it would be a hard thing to do, but I honestly feel like we're going to have a shift to that anyway, because the funding is drying up, or rather it's being cut. And yes, the pendulum will hopefully swing back, and we will, you know, the research grants will start rolling in again. But it's like, to survive in the meantime, we're going to have to get back to our community. We're going to have to really, the example that I always give the students, I was run over by a car when I was 7 in reverse. In his defense, I was running across the street. So when he looked in his rearview mirror, I probably wasn't there yet. But I remember that he ran me over and the whole block came out to see if I was okay. The whole block came out to see if
Yeah.
I was okay. Now you got videos of people posting where people are getting assaulted
Right.
in public and people are just standing around.
Right.
Like, we're so desensitized. But again, and I mean, yes, I was crying, but I was relatively okay. But the whole block, like, people came out of
Yeah.
their apartments
Yeah.
to make sure. A man carried me 2 blocks. And I was
Wow.
a thick 7-year-old. He carried me 2 blocks to my babysitter's house. And which is not to say that there aren't people out there like that now.
Sure.
And social media like definitely pushes a narrative. But we have to come back to the community narrative.
Yeah.
We have to come back to the community narrative. Again, we got to be sharing our stories. We got to be sharing our resources and not automatically thinking of, if I give you, if you have, then that means I can't have.
Right.
We have to get out of that.
Yeah, we got to get out of that.
And I want for my students, I want that for my child. I want us to be, again, a communal space.
Yeah.
I don't know exactly what that looks like, but I know it's got to be better than this. Because I was very intentional with like choosing. My daughter has, and people will be like, how could she have so many? My daughter has 5 godmothers and 3 godfathers. And it was because I wanted to be very intentional about the village that my child had.
Oh, that's beautiful.
And I want, she has, each of her godparents were chosen for a different reason. And because it's because I feel like there are different things that they can teach her, and that there are different ways that they can hold her. And I want that for everybody.
Yeah.
I want everyone to be able to have a village that supports you.
Yeah. I love that. That's a great vision. That's a great vision. Anything for yourself personally? Like, give yourself a nap today.
Well, so, and again, I always use my like life trajectory with my students of like, it's okay if things change.
Yeah.
Once upon a time, working for the world, I can never say it without like World Health Organization was peak for me. And now I'm like, if I can grow my business and continue, like I said, pouring back into my community.
Yeah.
And I have, like I said, multiple aspects of how I do this. That's enough for me.
Yeah.
That's enough for me.
Beautiful.
Because if I'm continuously pouring back into my community and making sure that my community is good, and my child is watching me as she grows up, she's going to have that same heart, that same mentality.
Yeah. Yeah. Thank you so much. This has been great. And all the stuff about, being a public health professional and being a mom and being an what did you say? A Black African American woman, mother, is very powerful. That's very powerful. So I want to make sure that our listeners know how to connect with you to learn more about you and about your courage. So what is the best way?
I have a website. It is drkshealthminuteextended.com. I'm also on all the socials. It's dr.ks.healthminute. And then I'm on LinkedIn with my name, Rahmatu Kassimu.
Yeah. So we'll put all of those links in our show notes, which are on the website for this episode. So it'll be easy for people to connect that way. And I will say, I really like your website. I told you that before we hit record, but I'll just say it again. I think you have I really enjoyed looking through your website. So
thank you.
This is great. Thank you so much. And I'm glad we're connected now.
Yes. Thank you for having me.
Sometimes courage is doing it scared, leaving a familiar path to follow your purpose. Sometimes courage is telling the whole story, refusing to let silence or stigma erase what needs to be known. Sometimes courage is returning to the wisdom of your village, building community where systems have failed. Dr. Rahmatu Kassimu, also known as Dr. K, reminds us that courage can be tender and fierce at once, rooted in heritage, strengthened by lived experience, and shared through the stories that help us heal. You can connect with Dr. K on her website, www.drkshealthminuteextended.com, LinkedIn, Facebook, Instagram, and TikTok to learn more about her work and her courage. All the links to connect with her are on the show notes page for episode 27 on our website, courageouspublichealth.com. Before you return to your day, take a minute to sign up for the weekly Courageous Public Health podcast email updates so you never miss an episode. You can do that on our website at courageouspublichealth.com because there's more great stuff to come. So thanks for being here, and until our next episode, stay courageous. Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.